So thank you. Thank you, colleagues, and welcome to this webinar. I'm going to take you through the WHO Code of Conduct. WHO is committed to enabling events at which everyone can participate in an inclusive, respectful, and safe environment. WHO events also are guided by the highest ethical and professional standards, and all participants are expected to behave with integrity, respect towards each other, all the people attending or involved in any WHO event. Next.
Okay.
For the code of conduct, next, Dr.
Can you see my
Tiago?
slide?
Yes.
Can you see my slide? Yeah.
Not yet. Go to the next slide.
Next. Oh.
Not yet. I think it is network.
It is frozen. Okay. It was here.
Yes, thank you.
Okay. Yeah.
Yes, so we have interpretation available in English, Portuguese, and French. So you can click on the interpretation and select the language that you are comfortable with. Kindly use Q&A for questions regarding the topic and presentations. While the presenters are presenting, you can post your question in Q&A and we will be answering you. And use chat for questions regarding IT or logistic or to introduce yourself. I can see that most colleagues have started that. Thank you. The sessions are being recorded and your attendance is a consent to be recorded. So all the session materials, including the recordings in all 3 languages, will be emailed to you in the days following the webinar. Your feedback is also important to us, so we kindly request you to fill the survey that will be shared after the webinar. Next. Project ECHO also collect all your registration, participation, Q&A, chat comments for this webinar, and they will share them with WHO. So your individual data will be kept confidential. The data may be used for reports, maps, communications, and to inform new initiatives. So we welcome all of you, and we hope that you're going to enjoy our webinar. Well, thank you, and over to you, Dr. Tiable.
Okay, thank you very much, Dr. Lado. This is a great, really housekeeping information. And so here is the objective of this webinar. We're going to give the floor to Professor Balde to open this. So over to you, Professor Balde.
Yes. Thank you very much, Dr. Cheble, and good afternoon. I hope that you can hear me. My name is Cherno Balde, and I'm currently calling from Brazzaville, where I'm on mission, and but I'm usually based in Dakar. So thank you really for this great, opportunity for a cross-learning and a mutual and collective learning, really. Thank you, Dr. Traore, Dr. Lado, for really having organized this important event, but also to our really very important guest. I'm talking here about Dr. Christina from the University of Washington, Dr. Barry from Ireland, and also Dr. Catherine from the Nature Conservancy. I'm saying it rightly. So thank you so much, honestly, for being with us. And I know this is Dr. Traore's network and Dr. Ali's network, and we are really very happy to have you with us and to engage almost 200 people at the moment. We hope maybe more people will come. I'm seeing people introducing themselves from different countries, so it's really a great opportunity, even if it's online, but I think it's really a great opportunity. You know, in WHO, currently we are saying definitely that the consequences of the climate change is the most important, health risk for the 21st century. It's really quite obvious. So this is something just highlighting the importance of this topic and on this matter, for us, for public health professionals. So it's really important that to engage people, to try to understand each other a little bit more and try to learn, from all of us, and to be able, to get prepared and to prevent and to respond to the consequences, to the health consequences of the climate change, and which are really, really important. we are seeing them happening every day. If it's not about heat waves, it's about floods, it's about new diseases, or maybe to barrier transmission of germs, even the COVID somehow. So it's really, really important, really major. So having this opportunity, this platform to have these high level of expertise and also these participants, to have this conversation is really a great opportunity and a great honor, for us to host you. So I will not take too much time. It was really to thank you and to encourage you, to go through this conversation. I understand this is the third session, and so I think it's a process that we have started. Let's continue on it, and maybe also I'm a very operational person. Let's try to have, something tangible at the end, on which we can work on, which we can continue the discussion and to continue cross-learning, amongst ourselves. So once again, thank you so much, colleagues, for your presence, your participation. I really wish you a very good, meeting, and over to you, Dr. Traore and Dr. London. Thank you.
Okay, thank you very much, Professor Valde. This is a really great welcome remark, and thanks for all the encouragement and support as well. You and the leadership and colleagues as well around the world, because this webinar is really organized in the spirit of One Health. And I'm not going to define the One Health here because there are people here present who know better than I do. And I think this will be exciting webinar and the subsequent as well. So I will just without a delay, I will give the floor to Dr. Christina Breton-Fleur, who is really an associate professor and director of School of Medicine, University of Washington. She is one of the guru in One Health, as Dr. Barry and Dr. Catherine as well. So over to you, please.
All right. Can everybody see my presentation? Okay, good.
Yes,
And
it's very
this will
clear.
be, thank you. Good
If
morning.
you want to, you can put your camera on so people can see you presenting. That's really fine with us. Otherwise, crack on, please.
Okay, yeah. So, good morning, bonjour, and it's a pleasure to be here with wonderful speakers. And my presentation will be available at the end, so I'll be very fast. But if I miss something, it will be here. And it'll be 3 languages sometimes. So thank you very much to being here and being invited by the WHO Afro webinar series. I'll be sharing with you experiences that we have from the global South. And from that, I even would say, in a good way, let's make the global South great here again, because together we can share. But also, it is important. I just wrote that we'll share the global South experiences to tackle climate change and pandemic prevention, listening to Latin America and African voices. However, we're going to listen to everybody's voices. That's the importance, that we can unite the global North, the global South, the East, and the West. So we're here all together. One second. And so it's very important for us. I will be mentioning today the indigenous tribes, the minority communities. And since I am in Seattle in the United States, and we are in the land of indigenous land, we always acknowledge where we are. I also would like to share that because I'm a Brazilian also with roots from the indigenous tribes, I also acknowledge my own ancestors. Just briefly, I'm a veterinarian. I graduated from Brazil. I have been in the United States for 36 years, working in, as you can see, since a veterinary student in Brazil, already with the One Health, already this connection with the human, plants, and animals. And the most important for me, when we used to go to these rural communities, was to the human connection or communication and sharing our knowledge with each other. There is the main message. If I don't finish today in 20 minutes, the main message, I'm starting with my conclusion here, is for both of us in the global North, global South, through One Health, we can learn from each other. We can design together by listening respectfully to each other. We can collaborate and cooperate, and we can co-create ideas and actions together for any time we need, especially during preparing during climate change. One Health, and as you're going to hear again and again, very important definitions, but briefly, One Health also includes economics health, social health, political health, indigenous health, environmental health, and climate change risk. So today we're going to focus on the indigenous health, environmental health, and climate change risks. It is very important for us to go and look at the national biodiversity strategies and actions plans that was just recently developed, and it's available, and how much we have to participate when it was presented at the COP16 in Colombia. Of course, when we talk with One Health, we are following and we are, as you're going to recognize yourselves in one of these numbers. And the most important, it is making the number 16, peace and justice and equity to all of the world. And we're here today doing partnerships to achieve these goals. When we talk about One Health, as you can see, it's a multidisciplinary, interdisciplinary teams, and it's very important to be on this cosmos where we, as individuals and as humanity, we come from our egos and go to our echo. So it's a change every day. We cannot change humanity if we not start changing ourselves first. So it's always important to see from ego to echo, we can achieve our dreams together. Very important to show that the importance of the multidisciplinary and interdisciplinary and transdisciplinary professional teams that they works with the communities. And when we come out of it, it's very important to have our own professionals. It's very important we have our own expertise, our own knowledge. But instead of being silos, we connect this knowledge together. You are going to hear, and today we will not be able to discuss each one of them, but it's important that we know what is One Health, what is eco health, what's planetary health, what is One Welfare. I even said, what is intergalactic One Health, since we are all here in this world. There are several books and publications from the past over 2 decades, over 20 years and even more, that has been well established. Matter of fact, we just discussing earlier, we have a book that was just recently published that has exactly all the definitions and the history. One Health concept is not new. There is a whole history from a long time, and but it was just now into 2000. It was 2015 with the tripartite, including the World Health Organization being very active, but it was just finally the last definition of the concept was developed by the OLAP in 2022, available on the website. And to download also this One Health Joint Plan of Action. As you can see, the quadripartite with all the global organizations. So it was very important for us, who was working on the field as the front line, especially on pandemics, for instance, or preventing and controlling infectious diseases or new emerging diseases, or any tasking climate change's effects. It was very important to have this plan of action and this connection of the 4 organizations, but not only that, but making officially, because now we can have, there's something very important that we can share when we're implementing One Health, and that's the experience of Latin America. We always, usually from the Latin American experience, and it's a bottom up action of One Health. We're already on the field, we're already working. However, we cannot work without the public policies, and that's why this was very important. So we have the public policies, now we have the government, different stakeholders that can work together, the researchers, all of us who are in the field, and the public policies. And this is why it's very important to have top, bottom up, Global South, Global North are working together. Just again, in Brazil, as at the same time it was happening all over the world, in Brazil since 2007, we have already officially implemented the One Health through the Centers for Disease Control, which was also already working with leptospirosis in the northeast of Brazil. It was mostly by the 2010, 2015 that we start having a more, and also with the One Health, One World conference that we had in Brazil, again, bringing together different professions to task complex issues that are going on. So I just wanted to share that in Brazil also, since the 2000, it was also a long time ago, but briefly in 2009, it was due to leptospirosis that was the first working together in this concept of One Health. So again, it's not new in Brazil also. And then now we have all over Brazil that we have several centers of excellence of One Health. As you can see, I'm bringing again what we call bottom-up implementation of One Health, where we have, and I will leave, you will have available this experiences also from Latin America, including Brazil, Chile, and Colombia, and the whole history that at the same time that was happening all over the world in 2004 through 2007, that we're also developing in Latin America. And this was happening at the same time in Africa. So this is a global movement and not only related to one place. We have all these publications in several languages, which is very important to translate. Again, how we're going to strengthen preparedness to address the tackle climate change by having different languages as well, by different participations and inclusion. So here just several publications in Portuguese that has been available already. One Health includes, and I'll be talking about zoonotic diseases today, but goes beyond zoonotic diseases. So what we call the social and environment determinants of One Health that many of our colleagues will share later as well. But it's very important when we talk about One Health, we're including human health, animal health, plant health, and the environmental health that are intricately interconnected. But as you can see, beyond the zoonotic diseases that are related to climate, other results that happen also. For instance, it impacts the water quality. It impacts the food supply, so food safety and food security. It is related to environmental degradation, as I will share some examples today. And the extreme heat, not only this, but can affect the minority, especially the elderly in the urban areas or even in the rural areas. And the severe weather will bring including mental health impacts, but fatalities, and other non-infectious diseases such as asthma, allergies, cardiovascular diseases. So, but not only then when we talk about that, it is, even though it says in human health, animals will be affected as well, plants will be affected as well. So just a brief version. And not only this impact, not only impacts the health the social, political, environmental determinants. Also, it's very important to bring health equity, food security and safety for all, oral health and mental health, and the most important, which is very similar, for instance, with Latin America and Africa and Asia, the global south, it's the wildlife trade, health risks, and pandemics, which for that we'll need only one who lecture next time, right? To share, which is very important. So I just wanted to briefly bring what is important. But as you can see, how vulnerable in populations are more affected from any climate change. Over half of known human pathogenic diseases can be aggravated by climate change. And there are several diseases that have been shown already that 58% of the infectious diseases are related to climate change. In Brazil, for instance, we have how throughout the years, we have been changing what happens if we change just a little bit of in centigrades. We're already there. We used to say that in 2030, we're going to have a whole different Whether we're already there and we have to do something immediately and together. Challenges. What are the currently challenges that we're experiencing, for instance, in Brazil recently that is related to climate change? For instance, we have disasters and which will bring new emerging infectious diseases or already or the zoonotic diseases. For instance, we had in Rio Grande do Sul, which is the south of Brazil, we had just last year a disaster due to flooding. And I'm sure this at the same time I was in Africa, and at the same time was happening in I was in South Africa, but it was happening the same changes, weather changes, and floods as well. So that's why I wanted to bring the similarities we're having. We had what we learned from this experience that we do need to get together so we can respond to climate disasters. We need to have there are different complexes responses from all different sectors, but we're not united yet. So made even worse to be on this disaster, especially in the region was not expected. There is now, this is a good news. We have now a national interinstitutional One Health collaboration that was again from the government and also from the actors in the field to work together, or a national One Health plan. There is an increase of leptospirosis cases. However, we were not able to have a data system, so we need to develop a platform, not only national, that we have some, but we need to develop it at the global level as well. And we do have to have the emergency planning and preparedness. This is how it was, and I'm sure who works with the cities are very familiar. Oh, and I just wanted to share, we have this horse who during more than 48 hours, or it's called caramelos, survived. So he's showing, and that's what they said, the resistance of the population for survival and resilience. So how important it was. And now he's still alive, and he's like remembering how to be resilient. I wanted to share also how it's important to, in One Health, the outreach to go also to the communities. And this is one example, that Leishmaniosis, it's a project called Leishman, where is also brought to the education through the elementary schools, where you can teach through arts, as you can see, theater, veterinarians, physicians, and all the health professionals dressed up as a mosquito. So you can, through arts and theater, also bring this what do you call, infectious diseases control through the community level. So having the community involved is very important. Not only that, but as you can see, what is the other factors related to visceral leishmaniasis in Brazil, for instance. As you can see right there, climate and environmental changes. Other related factors all through these different diseases are, again, the habitat destruction, as well the climate change. It's besides the education through all levels that we bring the One Health, we also have a research. One example that through One Health, we developed this multi-centric project. It's very important, I will say this as well, that was funded by the Brazilian government. So it's very important that we empower our own governments so we can have sustainable funding for each country and support each other. So, and this one was funded by the Brazilian government, and we were able to be the first ones, at least in Latin America, to show the COVID in pets. And again, it's all available in public. I'll be glad to share later. Other project we have also is called the Bolt of One Health, where many different students and professionals go to fishermen villages as well as indigenous populations, communities, to have this research projects. As you can see, when we talk about One Health, we don't only collect samples, but you also involve the community since the beginning of the project. In this case, you include also the environmental changes, which is always forgotten in One Health and how important it is. So matching, another important thing, just recently we just were awarded with Gates and Brazilian government grants to support local communities. Again, the project through the global challenge is climate change, loss of biodiversity, and enterprise. The communities were included since the beginning of writing the projects, and that's what it's very important, an achievement of our experiences in Latin American. And I work with Africa as well and Asia as well, and we do have this community involvement, which is very important. And this is our experience that we can share with our colleagues from the global north. So we need to be together because of this importance that, or I would say, sustainability of our studies, or even to have the public policies. How do we strengthen preparedness to tackle climate changes? Again, there are social, political, cultural differences and environmental and determinants. It's important we tackle health inequalities and inequities. I always say the next definition of One Health has to have the word peace as part of the definition. There is still unsustainable exploitation of natural resources. There are health risks related to illegal wildlife trade. There's loss of biodiversity and deforestation. And it's very important through political changes that we stay strong and connected to maintain this good changes that the other, for instance, climate changes will bring to us. Very briefly, how important it is to have the public policies. That's when the global organizations are very important, and that's how for the World Health Organization is very important to bring to us all these public policies. As you can see, there are several documents that are very important, again, from the ego to echo, and one world with different words, we can make one planet. And they're already very documents that are guidelines. And we also have our own national guidelines. I'm talking only about Brazil here, but we have in different Chile, Peru, Ecuador, we have as well, and different challenges. Other documents that can bring change. Since I am done and I'll be able to finish another time, but I just wanted to bring the importance, how it's to bring the indigenous populations as part of the cooperation and collaboration. And this is available. Why? Just, it's very important we develop trust first, and then we can communicate. And one thing also, One Health came even before all this modern concept that we know. It came over 10,000 years from the indigenous populations that has already these systems thinking and connection with ecosystem approach. The importance of include all the different belief systems, how we are already working with infectious diseases and climate changes in indigenous populations and local communities. How do we do that? We work directly sharing the scientific knowledge and the indigenous and traditional knowledge, and how we can have the centers of excellence of One Health. For instance, this one in the Amazonia, this one in different countries such as Colombia, Peru, and Bolivia. And the importance to bring the community involvement, such as I brought here, Africa is already doing this as well, which is increase the effectiveness of anything we have to do to tackle climate change, health and health risks. And those are just examples, and how we can get it together. Again, from both ways. Right now, we are working on a national plan, One Health plan, not only Brazil, but other Latin American countries, but it had to have all the sectors involved. Was it easy? No, very difficult. But we're able, through One Health, to speak the same language, and we're being successful in that. Of course, I bring this from our African roots. If you want to go fast, go alone. If you want to go far, let's go together. The recommendations is for us to be united, have all the sectors working together. The world is burning, the world is being destroyed. We can't let that happen. And through different syndemic approaches we can have, and different organizations that are already working through One Health, as you should all be involved. And do not forget the oceans. These wonderful breaking barriers. We are only one. We're one planet, one ocean, one health, and several organizations that are global for preventing the next. We don't want the next pandemic, prevent the infectious diseases. And again, I finish it to say we can learn from each other, we can design together by listening respectfully, we can collaborate and cooperate, we can co-create ideas. Thank you very much, and I'm very happy to be here with all of you.
Yeah, thank you very much, Dr. Christina Bettenbroer, and thank you for the great presentation and to set the scene as well. And please, if you have a question, as Dr. Lado say, you can put in the question and answer. And Christina, you can look at those which are addressed to you, and you can answer them before moving to the question and answer session for 10 minutes. Now we will move to the next presentation, which is on the biodiversity loss and implication for human health. And Dr. John Macomb from the University College Dublin, Ireland, will present. Welcome to you, Dr. Barry Macomb.
Thank you very much.
Thank you to have you again.
It's great to be here. Thank you, Dr. Thieble, for the introduction. Thank you to WHO Africa for inviting me to talk, and thanks to Professor Balde for the introduction previously, and also to Christina, who's provided a wonderful sort of backdrop across a range of different aspects to talk about. I'm obviously going to sort of focus in on one of the aspects. Can you see my slides okay?
Nothing.
Hang on there for a sec. How's that? Can you see that?
I'm not seeing it yet.
Ooh, I don't like this. Give me one sec. There we go. Third time lucky. Is that better?
Perfect. Thanks.
Great. Okay, so as I said, thank you very much to all of you for various different contributions. So, my name is Barry McMahon, and I work in the School of Agriculture and Food Science in UCD. I'm sort of an unusual animal in terms of the fact that I'm a conservation biologist interested in the epidemiology of zoonoses, and I work in an agriculture school. So that's sort of a bit of a strange combination. I'm an associate professor here where I spend most of my time looking at birds in particular in agricultural systems to see how we can get the balance between, bird diversity and ecosystem resilience and ecosystem production in terms of food production. And hopefully you'll see where I'm going with this. So bearing in mind like the big world of One Health and where One Health has sort of come from with dealing with infectious diseases that are zoonoses. And I've been involved in aspects of that. We're sort of pushing on towards sort of using the One Health idea to develop resilient food systems. And again, hopefully, maybe some of you are a lot more familiar with this than even I am, but you'll see sort of some of my ideas, what I'm trying to get across. So, a little bit like Christina, I'm going to give you a flavor of my ideas of how I think biodiversity is important to human health because I'm surrounded personally at home by people who work in finance or law or maybe even medicine, and we're having all these biodiversity loss issues, and I don't think they really sort of understand what they mean. So hopefully we can hopefully we can develop a way of messaging that's a little bit more effective, and hopefully if all of you aren't aware of it already, and even it's been mentioned thus far, you might be able to take that home as a message. Why biodiversity loss is an important aspect for human health, if you like. So just to give you a brief outline, I'm going to talk a little bit about biodiversity, what it is. Forgive me if I'm being very simplistic, but I want to sort of deliver a pretty simple message that's quite impactful rather than trying to overcomplicate it. Going to talk a little bit about biodiversity declines, what that means for disease, and that's sort of where it evolved in terms of One Health as a disease discussion. And then I'm going to talk to you specifically about why birds are important to human health. So this was an exercise that we did as part of a PhD study here. So again, what is biodiversity? So again, this is something that's all very probably familiar to very many of you, but we would sort of describe it as all living things from genes to landscapes and everything in between. So it's a very, very wide range of different aspects, and why this is core to human health is because of the functions and because of the services, this idea of ecosystem services. So what are the benefits to having biodiversity? So we have the idea of provisioning services in relation to food. We have the idea of regulating services in terms of the maintenance and regulation of services within a system. So for example, disease regulation or water quality regulation. And then we have the idea of cultural ecosystem services. So this is arguably one of the harder ones to communicate to people, why certain species are important. So why, do we associate particular animals with certain parts of the world? The classic example here is how sort of maybe the North Americans would associate eagles with their own country, or how the Spaniards would associate themselves with Iberian lynx or a different type of cat. So forgive me in terms of the references. I'm gonna talk from my context here, from reflections in Western Europe, if you like, in Ireland. So that's where I'm coming from. But in terms of the global issues, if you look at recent biodiversity loss, so the Living Planet Index, which has been developed by a number of conservation organizations. So it looks at the population of 21,000 species, or populations, I should say, of mammals, birds, fish, reptiles, amphibians around the world. And when they monitored those over a 50-year period, the numbers are absolutely frightening. So the latest index would say that these declines have averaged 73% in terms of vertebrate populations between 1970 and 2020. To me, that's an absolutely terrifying statistic. I'm sure many of you are aware of this, and this is just across the world. There are data to show where that breaks down in relation to various different continents. I'm not going to get into the details around this. This is worth a discussion in itself, but it's just a sort of an indicator of the fact that not only is the world burning, as Christina said, it's also vanishing in terms of our wildlife. So, in couple with that, we have an estimated 1 million animals and plants species that are threatened with imminent extinction. This is as of the 2019 global assessment by the Intergovernmental Science Policy Platform for Biodiversity and Ecosystem Services. So that's another sort of level of information in relation to biodiversity loss. And in relation to my own country, so Ireland, I can say it because I'm Irish. It's a sort of a rock off the edge of Western Europe. compared to the size of some of the countries that some of the audience are from today are from, and we have a diabolical record in relation to biodiversity. So if you look at this, image here on the right hand side of on the presentation, and you see along the zero, so that means along the zero means that the populations have been stable. So over the last 20 years, you can see that our populations of bird species, this is just bird species, but in general, they have not only have they declined, but they've plummeted. So they're absolutely crashing. And overall, the numbers would say that 25% of our bird species are at risk of extinction. So we have a terrible record as well. It's something that I like to remind many of my countrymen and women. So, again, to some of the less informed people might go, well, why is this important? Or people who don't have the time to think about it, why is it important? Well, if you look back at sort of how the world was a long time ago, and you look at the ratio, and if you look at the base of the x-axis here, you'll see wild animals to domesticated animals to humans, and you see the ratio that used to exist in terms of 10,000 BC. Now that's obviously a very long time ago, but look at the way in which the ratio has changed from 10,000 BC to just over 100 years ago to say 70 years ago to 20 years ago. And if you look at how the projections are in relation to the ratios of wild animals to domesticated animals to humans, there's almost no space in the world for wild animals, because it's been taken over by humans and by domesticated animals, because we obviously need to feed ourselves. So how does this impact in terms of health? What's the functionality of this? Why should we care is often what we discuss. So if you look at this paper that was written in 2013, and we talk about zoonosis emergence risk and what's the driver in terms of agricultural intensification, which would be linked to the explosion in domesticated animals, but also in terms of environmental change, how we would remove the space for our wildlife. So the results would indicate from this discussion would that, based on the previous diagram and that there's a greater interface, so there's greater chance of interaction between humans, domesticated animals and wildlife, and this is likely to increase as time goes on. Therefore, you have a greater spillover of zoonotic infection of these humans, diseases that occur in humans that were sourced in wildlife. And again, you say, well, how does that actually happen? But if we look at this paper that was published in 2015, this is a marvelous example of, I suppose, the connectedness of wildlife and the connectedness of humans. This is like a One Health infogram. This is like a diagrammatic presentation of One Health, because you can see on the right hand side you have the human pathogens. So this is the diagram that demonstrates the pathogens that are shared between various different taxonomic groups. So between mammals, between primates, between domesticated animals, between reptiles, birds, fish, amphibians, rodents. And you can see essentially that there's basically exchange the whole way through it. So this discussion that we've had in the past few slides saying about the chance for interface and the chance for contact, what does that mean? It means that there's greater chance of this flow happening between pathogens from wild animals or from domesticated animals into humans. So there's basically a much greater chance for zoonotic spillover. And we have the data to show that, because over the last 30 to 40 years, the vast majority of new diseases that have occurred have been zoonotic in nature. So they have occurred, and not only have they occurred, as we said, from sort of non-human sources, but they've also occurred mainly from wildlife sources, which again sort of exacerbates or it backs up the points that have been made by the previous two slides. So very quickly, I just want to discuss the idea of the biodiversity and disease, and this idea that biodiversity loss has been labeled with disease outbreak, and that's true up to a point, and this was referred to as the dilution effect. But I think that sort of oversimplified things, that, in terms of actually informing ourselves in a One Health context, we need to look at maybe ecological or epidemiological evidence and how this might differ in relation to different contexts. So there is an idea called the dilution hypothesis, where there's reduced biodiversity, there's more disease, and
Il
Lyme
y a,
disease was an example.
par exemple, on a pris l'étude de la maladie de Lyme.
European context, we find something different, actually. So the thing to take from this diagram is, don't try and take it all in, okay? Because there's quite a lot of information there, but just take three simple messages from it. One, it's complicated, okay? So that means saying something simple like disease is linked to increase or decrease in biodiversity is oversimplifying it. The second thing is the abundance of the pathogen reservoirs is important. So the abundance of the birds or the rodents is really important, as are the reservoir, or as is the ticks which transmit the disease. So there's an argument here in relation to this diagram, and you're just going to have to sort of take my word for it, that biodiversity increase actually might increase disease transmission. And this has been found in relation to a situation in European Lyme disease. So this is the indications in relation to this. So the dilution effect may be valid in certain contexts, but other important factors need to be taken into account. And we've already mentioned these in relation to other factors like land use change or intensification in relation to specific reservoirs. So we need to sort of examine the ecological processes together with things like the force of infection. So how likely is a disease to jump into a new host with respect to understanding these processes. Again, it's sort of just a link in relation to biodiversity loss and the dynamics in relation to human disease. What I want to sort of finish up on is to look at sort of a positive link between birds and human health, and how a student who is working with me, Amy Gray, developed this pathways for positive relationships and improved integration. And this is sort of like a functional reason why we need to have birds. So I love birds. I'm a conservation biologist, so it's easy for me to sell this, but I suppose I spend a lot of my time trying to explain to people why the diagrams in relation to bird diversity loss are important to humans. And this was actually a very functional way of doing it. So there's 6 possible pathways in which you can look at these. And maybe some of you can think about your own species in your own countries, and you can tag this onto them, and you can say, well, this relates to a particular species, and you can bring it home to yourself. So I didn't put in specific species. I've just put in the pathways and how they might relate. So the first one was psychological benefits. So the being around bird species helped individuals who are dealing with, depression or mental health challenges in that particular context. The second one was sort of a physiological benefit. So not only did you get the mental benefit, but you also got the improved physiological function and better general health as a result of engaging in association with bird species. The third one was like basically the non-communicable diseases, so decreased inflammatory and other non-infectious diseases. So reduced cardiovascular issues, reduced upper respiratory tract, and diseases like asthma as well. The fourth one relates to what we were discussing about already, which is the idea of reduced infectious disease transmission. So there's an argument that if you increase bird diversity and increase bird species richness, there's reduced transmission of West Nile virus to humans. Okay, there are papers that show that. The fifth one relates to aesthetic, cultural, recreational, socio-economic, spiritual benefits, quite a wide range of benefits there in relation to spiritual well-being, supply of local medicines and contribution to religious burial ceremonies. Some of you may have heard of like the sky burials that go on that are carried out in Asia, which is there's a very, very strong relationship between the vulture populations and some of the local populations that occur there because of this process. And then the last one relates to sort of tangible material and resiliency elements. So this is like material goods such as food, raw materials, and medicines. And you can link these back to the three ecosystem services that we talked about initially in relation to the benefits of biodiversity in general. And to bring it away from birds again and to discuss the sort of biodiversity and health in general, how do we better integrate this? Well, in terms of biodiversity and human health, this is not a new idea. As Christina has already said, some of the native tribes have been doing this for millennia. And I just have, the idea of integration of animal health, plant health, ecosystem health in the form of the One Health approach has been around since Aristotle, at least. That's where we sort of first believe it was documented, if you like. And some of my colleagues who wrote various chapters in the book that we were discussing earlier have put this sort of timeline in place, which I think is quite useful. Many of the ways, whether we talk about new legislation or new approaches, and many times actually we know the right answer, we just need to implement it. And that's what I suppose I'm trying to say in a long-winded way here. And in terms of how we do this, there's a whole range of different systems, approaches in relation to this. And this is maybe a discussion for another day, but it's just, sometimes even though the approaches are might be simplistic in terms of how we would ideally implement them, they require a little bit of complexity to get it actually to work in terms of multidisciplinary, interdisciplinary, transdisciplinary approaches. And those are just two references that sort of advocate that approach. And, I suppose that the final sort of slides, the last two slides that I have sort of demonstrate that all of these things are connected. So if you look at sort of like land use change, that's going to impact on climate, it's going to impact on food and biodiversity fragmentation. It's going to relate to sort of ecosystem function. That can relate to maybe the vectors of specific diseases, and all of that sort of impacts on our big sort of measurements of ecosystem services and biodiversity that things like the Living Planet and the IPBES are trying to capture. And, again, going back to my own personal setting, if you like, the reason why I think this is important is because the way in which we can relate this diagram is really important to influencing this diagram in terms of how we can restore the ecosystem services of a piece of land. So a lot of time I would say to students, I would say, imagine you are given a piece of land. How would you manage it in a way that's equitable and that provides ecosystem services to a range of different important components to land functioning? So you need to produce food, you need to produce forestry for climate change regulation, you need to have biodiversity regulation, you need to have water regulation, climate and infectious disease mediation. So that's sort of like that diagram to me represents the ultimate goal in terms of balancing those services. But it's an awful lot easier to draw the diagram than it is to implement it if you're in charge of an area of land or a country or a section. So just to wrap up, as I said, I'm trying to link the ideas of sort of biodiversity and what it is and why biodiversity decline is important, both in terms of disease implications, But specifically, I suppose, in terms of birds and human health and how that sort of kicks back in relation to land use management. So with that, I will finish up. And if any of you want to contact me or if you have any queries, you can find me. And I'm sure these slides or, I'm easy to find. Thank you.
Thank you very much, Dr. Barry. And this is an excellent presentation again, following Dr. Christina presentation, excellent presentation. And thank you very much for this. We
Thank
will
you,
move
Tebe.
to always, colleague, please use the question and answer. I'll check to put your question. Then presenter will look at the question and answer. Some of these questions we will come back to that during question and answer session. Now we will move to the operationalization of One Health to address climate-sensitive disease risk. You have seen in the previous presentation how it is complex. Climate change can lead to several issues. Dr. Katerina Machalava from the Nature Conservancy will talk about the operationalization of One Health to address climate-sensitive disease risk. She is well known in the region and with OLEP as well, and advise the quadripartite, and so we get a lot of advice from her. And she works in collaboration with a lot of partners. And over to you. And your friends are online. Thank you.
Thank you. Thank you so much, Dr. Diable, and thank you so much, Dr. Lado and Dr. Balde and all of our wonderful, esteemed colleagues. I want to wish you a very warm and happy International Day for Biological Diversity. So it's really special to be spending this with you. And I just want to recognize that there's so much expertise in the region. So I see many friends online who I know are leading really important efforts. So there's a lot of knowledge really in our Zoom room right now. And so I hope to share some of the programs that are really leading the way. And I hope you'll connect with the colleagues who are involved in this work so we can learn more and really follow and learn together. So I will just share a few slides. And I really want to think about the connections between climate, biodiversity, and health. And we've had really excellent overviews of that. So thank you so much to Barry, to Christina for the excellent context that you really gave us. So I think we have this strong understanding now of how these are related. And, we saw this really striking statistic that is really scary, in terms of where we're headed with biodiversity and habitats and ecosystems. If we think about coral, and the oceans, what's happening with climate change, what this means for fish populations, for nutrition, for livelihoods, for ecosystems as a whole. And then really when we think about environmental health and really currently what unhealthy environments mean for health, and we see that more than 13 million, almost 14 million deaths per year really linked to these unhealthy environments. And unfortunately, the trends are very negative. We're seeing that the impacts from unhealthy environments are really increasing. So we are at this crisis point for multiple planetary crises, biodiversity loss, pollution, climate change, and then the impacts on health. But we have also this opportunity to work together across sectors in a One Health frame to really find the solutions that leave us better off today and tomorrow. So climate sensitive diseases, I think probably 5 years ago, if I had been giving this presentation, I would really be talking about some very specific pathogens and that's sort of where we were with the knowledge base. I think unfortunately now we see the scope is much wider. I mean, I think it's hard to even think of any disease that isn't related to climate change in a way. And so we see so many direct and indirect impacts. we think about if people have disruption of tuberculosis treatment, for example, and then how that can lead to antimicrobial resistance infection. So even just a few days or a week of not being able to receive treatment because of a disaster, linked to climate change or worsened by climate change, really serious for our routine health needs. And then certainly for the spread of disease that we see that can happen. Respiratory diseases from wildfire smoke, as we see, the extent, the duration of wildfires is really increasing because of the ways that we're altering certainly our forests, but also our climate systems. And then malnutrition from many, many different climate-linked interactions, but we can't forget about animal health here too. If we think about heat, if we think about infectious disease that is related to climate change, such as Rift Valley fever and the impacts on livestock, as we know, the malnutrition, the livelihoods impacts, the cultural impacts, that sense of place that we have in our cultural heritage. It's so important when we think about pastoralists, for example, who are so dependent on these livestock systems, and what this means when their animals can't graze, and then they can't have that production system that they've really relied on for thousands of years. And then if we see something like flooding events, leptospirosis, mold growth, spread of pathogens from, people in crowded spaces, when you lose your home overnight because of flooding events and you have to go and really be in crisis mode. So I think there's a humanitarian crisis that we're seeing, and all of these climate-linked interactions that we have to be thinking about animals and humans, and also how we can be more resilient for the future. So again, just to show here the variety of interactions. Unfortunately, there are so many. I'll just talk about a few here, but I think we always need to be really looking at how we can work to mitigate climate change and also adapt so that we are really ready and have healthy communities for today and tomorrow. I think in the region, there's a lot of great work on early warning systems, some of the world leading programs. I know of some on Rift Valley fever. I'm sure there are others out there. But really this value of information that can let us get ahead of some disease events, and also see this specific example is for El Nino events that can then really change ocean systems, can change temperature, humidity, rainfall. We can have access to this information sometimes 6 months in advance, and you can really mobilize a vaccination campaign, early warning, so that if you do have outbreaks, you can really be able to respond right away. And as we see, there's infectious disease risks, but there's also food and potentially famine and livelihood impacts too. Forest fires and haze, for example. So if we're thinking about respiratory health and fires moving people out of their home, and animals, how they're impacted as well. And so I think that the early warning systems are really a key tool. But then I want to talk a little bit about nature-based solutions and how that fits into our preparedness and our response, and really our prevention, so that we can protect health of people, animals, and our planet. And I joined the Nature Conservancy in October, and I was really struck by the 2030 goals. We all have goals in our sectors. In the health sector, we might not always be so familiar with the goals in the conservation world. But I think that they all really relate to health if we look a little more closely. So reducing climate harm for a livable world, if we think about temperature and just the impacts of climate change, how diverse those impacts are, how serious those are, really resilient ecosystems so that we can adapt to increased flooding events, for example. If we think about all of the cities that are on coastal areas where we're seeing sea level rise, where we're seeing increased rainfall in some cases, oceans, how they fit into our nutrition, our culture, our tourism, our livelihoods, and then our landscapes. We see the effects of land degradation and how that impacts our production of agriculture and food and our water safety, for example, from rivers, lakes, and wetlands, and what happens when those are degraded, even chemical pollutions, waterborne disease. And then really the role of communities in making decisions about their land and having that right to the lands that they have really stewarded for thousands of years, and a lot to learn there that Christina mentioned in terms of traditional knowledge and the importance of that for really being able to adapt to climate change and protect the biodiversity that we are so fortunate to still have on our planet. I just wanted to talk a little bit about heat because this is very important for the continent. And I think, if you're doing field work, if you've worked in a setting under the hot sun, you really know how severe this can be for your own health. And if you're wearing personal protective equipment, for example, it can be quite serious if you have heat stress. But if we're thinking about all of the different occupations, agriculture, construction, hospital facilities management, ranger workforce who are really exposed to this heat, and how it's increasing. It's very serious, and it really has these labor impacts, but of course it has health impacts and quite vulnerable populations often who don't really have other alternatives to overcome the risks. And I think the good news there is that nature can really play a role in helping to address this. And we see that tropical deforestation may reduce safe work for millions. That's a key scientific finding from a recent paper. But that means if we protect forests, we're much better able to have that beneficial cooling, those ecosystem services that nature provides. So really thinking about these upstream interventions. By protecting forests, we actually protect our health, and we reduce the threat from high heat exposure, for example. But there are many other benefits, and we heard the great examples with specific species that Barry showed, with the birds, but really thinking about the ecosystems as a whole too, and how ecosystem protection and restoration can play a role in our health. And so I want to really encourage us. I know the African region is leading on One Health coordination platforms. I think that's incredibly exciting. I have worked with a few. I see our colleagues from Liberia, Cote d'Ivoire, Ghana, Kenya, Zambia are all online. And I think we have learned a lot from the way that these platforms have evolved. And there's still an opportunity to bring in nature-based solutions and really say, okay, how can these help to mitigate the impacts on waterborne disease, on chemical pollution, if we're thinking about really large-scale and artisanal mining, for example, and chemicals going into rivers, going into wildlife habitat, and the people around those areas too, how they're likely to be impacted. So how nature can play a role, really thinking about this very systematically. And there's this term, nature-based solutions. You might hear it. Please see it as a key health intervention. These really provide very important health benefits that we often don't quantify or even recognize, but it's an opportunity when we're thinking about health system planning to really prevent upstream. So just a few examples here that we're seeing through our work at the Nature Conservancy. I won't go through them in detail, but we look forward to really sharing more examples, more case studies of this. And please also share as you're seeing these in your communities and countries, and as you're building them into your health system planning too. And then I just want to quickly talk about how climate change affects health service delivery. So we know that in many areas during the rainy season, roads are already very hard to pass through. You can see here, this is actually just the very start of the rainy season, and it's the road is quite washed out. And really the challenges that climate change will pose and are already posing in terms of making these flooding events worse and really damaging critical infrastructure like roads and hospitals. And then the importance of environmental protection and conservation in that. So you can see here really frontline healthcare providers working on safe motherhood, working on vaccination, really the front lines of detection of outbreaks. And then the collaborator here, a healthy community ensures a healthy environment. So these are really serving communities around conservancy areas, so conservation, pastoral livestock, populations, and then really how we can think creatively about reaching people when it is more challenging. And you can see here that the healthcare services are being delivered in tents in these really remote areas. So you might have to go on foot, you might have to have the camel bring the medicines, and then you really want to be there for some time. So you camp there and you provide your services there. And I think we have to be a little bit creative in how we're making sure we're reaching communities and not leaving anyone behind, as climate change really makes that healthcare service delivery, unfortunately, more challenging. Then some tools that we have. I think this is the good news. There are really good things happening that do leave us better prepared and able to prevent. And I just want to quickly say, I see our wonderful colleague from Liberia here, Mr. Barway, and we have rolled out training based on these IUCN guidelines for protected areas, really One Health in protected areas. This was a exercise we did with the awesome rangers, and really seeing how they do their day-to-day work, and it's hard physical work in the forest, really the front lines of the forest and what's happening, and of course, if we're thinking about spillover events, really the first to see something in the forest that might give us an indication about risk related to wildlife health, to spillover, and really building in One Health approaches. So I hope we can learn more about that in the chat and future webinars. And then systems thinking. I'm so happy that my co-presenters mentioned this, and really thrilled that there are some great initiatives here. You can see in the Nature for Health project, and this is a great initiative here in Ghana that we're seeing our colleagues really leading the way with designing a project together. So not coming in and saying this is the approach that we're going to take to reduce spillover risk, but really saying, okay, let's understand the system, who are the key actors, and then what are the needs, and where can we really build in a One Health approach to better understand the system together and be able to reduce risk together. So stay tuned for more information on that. And then I just want to close by saying, we have seen this definition quite often. Climate change is in there. I think we have to sort of keep coming back to what is the context, and especially when we go to the foundational principles. We don't want to be forgetting those. We don't want to be forgetting to bring in the right sectors, the right disciplines, the right perspectives, and I would say modern and traditional forms of knowledge. Those really both, we need that diversity of expertise and making sure we're not missing anything important, but really thinking about the role that nature plays, and the way that we're treating our ecosystems, nature, and our own human health in the response, in the result, to really be thinking about, what do we need to put in place now for systems, health systems, that can help us be safer and healthier today and for future generations. And I think nature is the way to get there, working with nature, and we can really find ways that are so positive for our own human health and our resilience, and also for our planet. So I want to thank you so much, and I really look forward to the exchange.
Fantastic. Thank you very much, Dr. Catherine Matalaba, for the great presentation as well. And so, colleague, join me to thank all the great presenters. And in the meantime, you can check the question and answer. Probably there are some questions there. And Dr. Lado will look at some of those questions and highlight it. So the question which were not answered. And the dear participant, please, if you want to raise your hand to take the floor to speak out, you are welcome to do that. But what we can really capture from all this great presentation, we have work to do. And we have tools, we have knowledge, and we need to know how to do it. And that's very important. And that's a key for preparedness. It's not just developing beautiful strategic framework, but it goes beyond that one. And that's the role of everyone. So everyone has an obligation, whether you want it or not, to be prepared before crisis. Even if, for example, ongoing crisis, a climate crisis, you have to be prepared to address it at all levels. And that's the responsibility for all of us. And we all know, really, we live in a system. It is a systemic world. We are not just we are part of it, and it is very complex. So we need knowledge from different partners, different stakeholders. They have the stakes and they have the stakeholding as well. I think the failure to bring all this, to take into consideration, will lead to more crises. So anyone attending this webinar, you should really question yourself, what can I do really to support? And that's the responsibility of everyone. And if we fail to do that, really, we put the world and ourselves in danger. And now you have seen the importance of equity in terms of sector, in terms of everything you have. You have to give the same importance, the same consideration to if we want to apply the One Health for climate change, for other health issues, we have to consider health of human, animal, ecosystem equally, all, without distinction. So we will move to the question. I will not dilute your beautiful presentation with all, so I just leave it. And so, Dr. Lado, do you have a burning question out there, which is not answered? Okay. Dr. Mark Yamambo is with us. Welcome, Mark. Dr. Mark is a system thinker. He worked with Dr. Simon Uruge, who is one of the leading figures as well. Over to you, please. You can fire your question. Thank you.
Thank you very much for the very great presentations. I think that's very, very interesting. I hope you can hear me.
Yeah, we can hear you.
Can you hear me?
Clear and loud. Thank you very much.
Okay. Yeah, so I really like all the presentations which I like. Yeah, I really like all the presentations because you have provided very good examples of how One Health can be implemented and to tackle climate change problems. But my question is, how can we put this into the political agenda? Because that's the most important problem from my side. I think if we don't have leadership, vision, and it might be very challenging at the country level to have this implemented. Do you have any example in country or something that you have seen on how ownership at the country level and political commitment has helped to bring this forward? Thank you very much. It's a great pleasure attending this insightful meeting. Thank you.
Okay. Thank you, Mark. Who wants to take it? Otherwise, I can start. I don't want to dilute your presentation again. Okay, thank you. Over to you.
Great, thank you. I'll just start. I'll just give two quick examples. I think at the One Health platform level, most countries in the region now have a One Health coordination platform at national and sometimes at subnational level now. And this is so important for making the collaboration routine. And I think the very strategic approach of having a chair or a role of a political figure, so whether it's your prime minister, your parliament members that are routinely updated, or a vice chair, a vice president chairing these One Health coordination platforms, that can really maintain that very high level momentum. And I would say through the financing as well. This is something that we're seeing actually through nature bonds right now, where it's a financial mechanism that's really helping to restructure debt. So you can bring down some of your country debt through commitments to protect nature long term, and to think about how to build in health there. Debt is really a limiting factor to hiring health workforce. If you think about the workforce shortages that we all know are chronic challenges for every country, but the role of debt in that, and I think the ways that we can pair these nature and health bonds so that we really have the workforce today that we need, but also are protecting our ecosystem so we have less disease burden in the future. So I think that's something that there's resources out there for nature and for health, and to bring them together for something very powerful. I think that can maintain some long-term interest as well. Thank you.
Okay, thank you very much. Yeah, Dr. Catherine Machalaba for this. Dr. Barry, you want to add something, or Dr. Christina? Yep.
I was going to say, in some respects, you know, Europe is probably one of the poorer continents in relation to implementation of One Health in some respects. I mean, I remember going to a meeting in the Commission, and they just said, in the European Commission, and they said we operate in up and down structures. Our political structures are the Department of Finance, the Department of Health, you know, the Department of Housing, and there's no bilateral, so there's no crossover between those sections. So I think what I'm trying to say is it's not easy, and it's lovely for us to talk about systems thinking and for me to sit in a university and say this is what we should be doing and all the rest. But actually to make it happen, it takes I think it's a very pertinent question. It's a very valid question to actually ask us to say that's all very well and good so say about how these various different aspects of life are important, but how do you actually knit them together and get them to work? Um, what I would say in terms of the political will, I would say that actually out of the COVID situation in my country, there's actually been an awareness of that we really missed an opportunity there. So that's something that we're going to look at. But again, actually, from listening to Christina first and subsequently Catherine, what you were talking about was much more integrated and to the point of the question than what I was talking about. So thanks.
Dr. Tibble, you are muted.
Yeah, thank you. Thank you very much, Dr. Barry. Dr. Christina
Yeah.
are you happy? You want
Yeah.
to add something
No, I
to our
completely
political
say,
business?
yeah, it's a very important and difficult question to answer. But I think what our experience has been education and sharing or learning the languages. And I'll share for my own experience and being a veterinarian from the scientific background, purely academic. And yes, I do work with the communities. However, when we came to talk with the policymakers, we did not speak the same language, even though it was Portuguese. So it is the words, even implementation, how I see implementation is different than the public policies implementations. And we even had to discuss that. So it was the breaking the barriers of languages among ourselves on the different levels. When we talk about one thing that happened for Latin American was including on the One Health national plan to include the politicians, maybe then senators, and then we have specific states with a One Health state law. And who did it was the senator who signed, but he or she had to understand what was One Health first, because it's completely, I will say, what is that? I don't know, one something. It was not important. So it had to us bring the passion and the importance that if something happened economically, that state was going to be a problem. So we had to bring the economics to the level of politics. So that's how we now have successfully have people being involved from the politics. Another thing also, politics change. So as it comes from the people being together, we can be stronger. So that's what I want to say, because the politics will change, but we stayed. And if we stay together through this One Health, when it's working, it cannot be just here on the air talking about it. We have to put into action. So those are just some experiences we have had in the Americas. And it goes
Fantastic.
up and down. So we
Yeah.
have to be together with other countries so they can hold us together. And when, for instance, you mentioned your country, you have a problem, we can now help and support each other because it goes like this, up and down. So I see as a global strength.
Okay. Fantastic. Thank you very much. Really, you all gave an excellent answer. And for political willingness, and I think, Dr. Mark, your question is valid. But if you look carefully in Africa, and all members have adopted, all member states, if we think there is no political willingness, engagement, we will be wrong, technically. Now, there another aspect. One Health is a tool for political engagement, because you can use the One Health to do policy briefing, to convince. Now we fail sometimes to do what we need to do, and we blame everyone else. This is part of failure of negotiation and failure of understanding the complexity. So I will stop here. I can see a lot of hands. That means it is very interesting. We have Dr. Ambrose Talisuna here, and we have Dr. Mike as well, Jackson. But I will start with, I'm not discriminating, but Ambrose is one of our really regional advisor. He works at Africa Union, the center now, but he always with WHO. So Ambrose, please. Dr. Talisuna, you are welcome to fire your question or admiration, please. Are you with us?
Please, who? Dr. what?
Dr. Talisuna, Ambrose Talisuna. You can ask to unmute. Yeah.
Thank you very much, my colleague Tieble, and nice seeing you all. Greetings from Addis. Very interesting presentations on a very valid topic. And I wanted to follow on, have a comment, and just really to follow on from what Tieble you have said. And I recall in 2016 when we were really struggling with establishing One Health, and we had this, at that time it was the tripartite meeting of ministers in Dakar. I think a lot has taken place now to push the quadruplet. And the point related to political will, I really think that we have opportunities to do this. Previously, the challenge has been, where do you steward the coordination mechanism? And we thought that stewarding it in a prime ministerial level, president's office, prime minister's office in the countries would be a great idea, but also those offices don't have the right technical staff there. But what we've learned from COVID is that really it was possible to do prime ministerial coordination at that high level, chaired by either the president or the prime minister. And I really think we should use that example. And these presentations here are really very critical, and trying to bring a coalition of partners driven by that level, I think we would move. And the gap has really been that we can have from the UN the quadruplet. But I think, and I like Barry's presentation, in our coalition of partners, we really need to bring in academia. You need to bring real multiple stakeholders who are going to push this. Those are just my observations, but really wonderful presentations. I think we have a long way to go. I still believe in a systems approach, and I really think silos will not help us. The issue is, how do we change the mindset of some of our leaders, both at the national, at the regional level, to start to have a system thinking, to say that we can integrate all these things. And once we cross that bar, I think the systems approach will pass. I really thank you for this webinar. I just had a comment. Over.
Okay, thank you very much, Dr. Talisuna. In fact, you were one of those leaders who gave me the green light to organize the webinar on system thinking. Yes, a few years ago. Thank you very much for that. Yeah. Okay, next we can go to Jackson, Dr. Jackson, and we know we reached the time limit, but just because of the interest. And so Jackson, you can go ahead, please. And then we have, otherwise the colleague, you can put your question, we will answer and send to you. Thank you.
Yeah. Can you hear me?
Yeah, we can hear you. Please.
Okay, I followed this presentation and I just got to know that it's very interesting. I really admire the presentation, and I think if we had the opportunity to have so many people getting involved with this presentation, we will know, we all will brainstorm and know where to start from. Some of the things that catch my attention was when I see the percentage of the migration of the animal, and we are talking about One Health. And I compare that with the urban migration with the human being. Taking also into consideration the ecosystem. What I have noticed, I'm speaking from Liberia in Africa, is that there, I noticed the urban migration is also affecting the ecosystem, because what I see is people move into the urban area and they don't have the financial capacity to erect the kind of a structure that is required to be. So you see, everyone is moving to the arable land or the lowland, for example, and they are destroying the ecosystem, and then they're trying to create the shelter, which I feel is not also good. And we see that the ecosystem have their own role that they play into our health system. And they are now destroying the ecosystem by just closing off the creek and misusing the river and the creek. They are now using it as a garbage site. And the animal are taken into the plastic and they are dying in the crabs and all of those things. So I'm just bringing this to our attention because for me, I'm reading epidemiologist and I am a paramedic, and currently I'm individual working with the administration because my entry position is a shipping assistant. And so it's very crucial to me, and it's an opportunity that I can be part of it. A brilliant presentation. I'm also bringing it to our attention so that policy makers will also have to come up with a draft that will have to protect at every level and taking into consideration everything that we are, trying to advocate for us, to see how best we can able to live in a healthy environment. But my question at last is, are we also considering the way in which we are going to plan to achieve our goal, whether we're starting from bottom to top approach or from top to bottom approach? Thank you.
Okay. Thank you very much, Jackson. And we got Dr. Charles. If you can add your question to Jackson's question, so then we move on up. Yeah. Okay. Hello? Hello?
Yes, we can hear you.
Oh, okay. You can hear me. Okay. Yeah. Yeah. Dr. Charles, and I think that will be fine. And the last question will be from Colin. Okay. Colin wants Dr. Colin from the major WHO Communication Center want to add a contribution to all this. Yeah. Okay, Charles, and then Colin, and after we have to close because the presenter are in a hurry. They have other meeting as well to join. Okay, thank you. Before they giving the last word and advice.
Thank you very much,
please.
Dr. Charles. I work as climate change and health lead for the Africa CDC. And I really must thank the facilitators for a very great webinar and critical information shared. So two perspectives from me. The first one is on the political will that was asked. And I think that first and foremost, we need to have that interdisciplinary and multi-sectorial will to work together. Then it becomes easier to push the political class, especially if we're fighting for one thing from the same perspective, it becomes easier. One of the things I see in Africa is gaps around sectorial equity. And because of that, not everybody have a buy-in. So you see at the political level, we have some form of antagonization because some sector are not pushing along with others, and that becomes a gap. But I think we need to strengthen that. Now, having said that, I think that there's a weaker link among the quadripartites, especially in Africa, and the environmental sector is significantly not optimally utilized in the One Health sector. And climate change is usually aligned to the environmental sector because I see in most of the countries, climate change issues revolve around ministries of environment and blue economy like that. So and that is why it looks like even at COP, health has not gained a significant entry. And we've been pushing for this in the continent, the same thing applies. So my question is going to be, how do we, one of the things we need for early warning system is be able to harness meteorological information and use it in health to intensify, to make our surveillance system more sensitive. I see that as a major gap. And the question now, especially to Patrick, in trying to address climate sensitive diseases, how do we better harness meteorological information to be able to inform early warning action in the health sector? Thank you.
Okay. Yes. Thank you, Dr. Charles. Your question will be answered in a minute. Colin, you want to contribute? Please contribute. You say you want to contribute. We give you the floor. Colin Boyke. Then we. No. Colin? Okay.
Yeah,
so,
hello, yeah, yes, I can. I
yes.
think I've just been unmuted now. I think listening to some of the contributions that are coming, particularly, I heard one of the panelists mentioning the fact that there seems to be different languages being spoken between politicians and other people. I personally think that this whole idea of biodiversity, climate change, I mean, coming from a science background, I think we are still talking science, and we may need to find the best way to make our languages more personal, solution focused, and emotionally resonant with policymakers. And for example, when you talk about climate change, people don't see what they want. They want you to talk about climate crisis. That evokes some sort of urgency. So they said, oh, yes, the world crisis, they see that, yes, something that they need to do. And also, we need to humanize our narratives. For example, sometimes we need to focus on things like show people how these things, just climate crisis is affecting their health, food, livelihoods, and things like that. So the key is going beyond this technical jargon and making our communications more relatable, urgent to particularly non-experts like political leaders and donors, communities, and even to the media. We may have to even put a team of journalists there where you really teach them how to communicate about these things. And we may need to use descriptive language. For example, yes, the word One Health already seems a bit abstract to so many people, but we can add other text to that where you could say One Health where people, animals, and nature thrive together. That way, somebody feels that, yes, I can resonate with that. And then we also have to move away from the usual technical systems thinking to a human-centered storytelling where, for example, at the moment, anytime you hear about One Health is a multi-sectoral approach to disease prevention and ecosystem health. But we need to move into a new way of communicating where you can say that, look, when animals get sick, people can also get sick. And when forests disappear, pandemics will grow. One Health is how we protect everyone together. You frame the statement in a way that it will resonate with people. And if you want to use a visual language to describe this climate crisis that we are facing, it's like One Health is like a safety net that is connecting people, animals, and the whole planet together. So everybody is in there. So we cannot have healthy people on a sick planet. And it's like a chain. So we are as strong as our weakest link. And that is one of the ways that we have to, I think, we need to reframe this whole idea of biodiversity, One Health, that it is not just science, but we tell people, look, it is common sense. When we keep animals healthy, nature in balance, and food systems safe, all of us protect each other. And then so One Health is how we stop outbreaks, feed families, and we secure our future. That way, our messages will be resonating with policymakers, farmers, communities, everyone. That's the way I think we should frame it. These are my suggestions. Over.
Okay, thank you very much, Colin. You are on board and you were never been included in terms of One Health. Now, communication is very important. Take the joint external evaluation, you will see communication in it. Don't exclude yourself from it. And communication experts should not as well. Everyone is really key player in terms of One Health, as the definition says. Now, I will open the floor for panelists, and just to took the question, the contribution, you can address it as take-home message, so we can close. Really, you've been instrumental for the region as well as for the global One Health. Thank you. Who is first? Okay, I will pick. Okay, Dr. Catherine Machalala. Over to you. Thank you.
Yeah, thank you so much. Amazing wisdom. So I'll just want to start on the point about the climate services, the weather and I would say even hydrological, if we're thinking about water flows and rainfall. I think that, some of that data is already out there. It's just not linked up to the health system. So in some cases, it's a matter of just getting those folks in the room, invite them to your training. Maybe on the third try, they'll show up, call them, sensitize them ahead of time. And maybe there are some needs that do require sort of additional planning and resources, but I think there's a lot that is collected. And then it's also the use of it. So something like radio alerts, getting the information out, even if you have the great data, it's then really getting it to the communities. And I just want to add on, there was a great point in the chat about education, Ministry of Education, get them in the room, leverage the school clubs, nursing, nature clubs, get them in the same room, get people used to working together. It's not easy to start, but I think people see it. Once they see the connections, you have to be excited about it. It's just, it's a great thing and a great opportunity. So thank you. Sorry, Dr. Tiavle, we're not getting you.
Sorry. Yeah, okay. Thank you very much, Dr. Machalaba. That's a great answer. And thank you very much for the take-home message as well. Okay, Dr. Barry, we go for you.
I was going to say ladies first, but you've
okay.
said...
You're right. Also, okay, thank you. Dr. Christina.
Sure.
Thank you.
First, thank you so much, Collins. You'll be the next speaker for the next webinar because yes, we're continuing these webinars. I always loved this. That out of the three of us talking today, we didn't plan what we're going to tell each other what we're going to talk about it, and suddenly we complemented each other. So, Collins, thank you for coming too as the fourth speaker and having this conclusion, which was very important. So based on your advice, I came with my final. Together, we're all stronger and we can trust each other. So this is where I finish here with my non-scientific language and from my heart. Thank you.
Thank you very much. Thanks a lot. That's a really excellent message. Okay, Dr. Barry.
Yeah, thank you very much. It's hard to follow those three speeches. Anyway, I'll do my best. No, I would just sort of echo that in many respects, how we say it is as important as what we say, and that's I think what Dr. Collins was trying to get across. I struggle with this all the time because I lecture to students, and it's actually a good exercise to see if you can relate something to a 17 or 18-year-old individual who's just out of, what we would call secondary school or high school, it's a bit of a test. But certainly, I mean, this is a discussion that's never going away. So this idea of communication and how to do it better, how to do it more effectively, how to reach more people is never going to go away. So I think it's really important that you brought it up at the point that you did. So I'm happy to wrap my point up there. I just, I'm spend so much time thinking about biodiversity and how I can relate that to human health. I have to forget. I need not to forget how to communicate that. So that's what I would take from the last couple of statements. Thank you and thanks again for the opportunity. It's been really enjoyable.
Okay, fantastic. Thank you very much. We reached the end of this webinar, as Tina just mentioned, and this is part of a series of webinars. There will be next session as well, and where you will hear more about the regional strategy for climate change for those who are new to it. And you will hear about a nature-based solution again, and with in more detail, and to complement what I was saying. Then we will follow up even climate change on mental health. So this is a nutrition as well. So it is really a series of webinars where we learn from each other. But what is clear is using scientific method wrongly, and it can be dangerous even for expert, then we don't talk about non-expert. And so for such a reason, always communication is done in 2 ways, and some people give it 4 ways. But it is important to know the interrelationship, whatever we do, and take into account the perspective of others, and without forgetting setting boundaries. And so these are very complex, and engaging stakeholders is not a simple thing to do when it comes to climate change, the risk and the impact. We have to think about everyone is a stakeholder when it comes to climate change, everyone, without exception. So it is a global issue and a way to really operationalize One Health. And we can be prepared because we need to live in an equilibrium with this, which called socio-ecological equilibrium. We don't have a choice. It is not a choice. It is obligation and compulsory as well. So we thank you very much for your great presentation and enlightenment, and really the region benefited from it. And we hope this collaboration will continue, and it will continue in the spirit of One Health approach as well. And you have the participant connected, and they will get your address as well, because knowledge sharing is an important part of One Health and preparedness, and knowledge distribution as well. You have been doing that, and that's the key for capacity building. Okay, thank you very much for really to all of you, and we stay in touch, and participants as well. Thank you very much for joining, and interpreters, we thank you very much for your support, for the great interpretation and administrative staff who supported us as well to gather all this information and to put in practice. Dr. Lado, okay, thank you very much for your support as well. Okay.
Thank you, all the
Okay.
speakers.
Thank you very much.
Bye-bye.
Thanks a lot. Okay, bye-bye. We stay in touch.
Bye-bye.
Yes, thank you.